hoping to rejuvenate his smile in time to celebrate his daughter's commencement. Anthony preferred a bridge rather than implant treatment for his missing tooth number 7. A child's graduation can be a personal catalyst for a patient to seek treatment. Anthony, 52 years old, shared with us that he was the father of a soon-to-be high school graduate, hoping to rejuvenate his smile in time to celebrate his daughter's commencement. Anthony preferred a bridge to treat his missing lateral, rather than a lengthy implant treatment. Our immediate concern was the extensive anterior teeth destruction. The loss of teeth has altered his occlusion relationships. Occlusal interferences have restricted the functional movement of the jaw, and have severely damaged the tooth structure. To transform Anthony's smile, we plan to rehabilitate his occlusion, starting with an interim composite build-up prototype that effectively sealed the edentulous space of tooth number 7. And lengthen the worn-out incisal edges of tooth number 6, 8 and 9, re-establishing the canine and protrusive guidance. Subsequently, appointments were made to prepare and deliver 3-unit bridges for teeth number 2 through 4 and number 12 through 14.